aren't exactly your jam. You also need to watch out for high heels. Injuries caused by high heels are actually on the rise. The Dr. Stephen Neufeld of the Orthopedic Foot and Ankle Center joins us now with more on the common injuries and how to prevent them. I can't think of a better topic than high heels. So thanks for coming in today.
You're very welcome.
Appreciate it. So we were just talking about this new study that came out and the fact that a lot of people are somehow managing to injure themselves while wearing heels.
It's incredible. It was a very interesting study. This group looked at injuries reported in the emergency room caused by wearing high heel shoes. They looked at patients from 2002 to 2012 and showed that there was an 82% increase in the rate of high heel injuries. There was double the injuries.
That is significant.
It's unbelievable.
And we're talking about what, falling off the heel, rolling their ankles?
Yeah, so most of these injuries occurred in the foot and ankle with sprains and strains. Some stress fractures occurred as well. There were double the injuries in 2012 that there were in 2002.
And, you know, they are tough to walk in. I don't know if you've ever put one on. But
no, I have to admit I've never done that before now.
They are tough to walk in, but they're pretty straightforward if you're in a certain state of mind. So how much do we think maybe folks were impaired while wearing these heels?
Well, I think there's two factors. First of all, the study actually showed that most of these injuries occurred at home.
Okay.
So hardwood floors, tripping up and down stairs.
Okay.
So I found that pretty interesting as well.
Yeah.
I think that impairment probably has somewhat of an issue as well. But, you know, just inherently, these high heel shoes are really not good for your feet. Biomechanically, they put you at a disadvantage, and you could really get injured from the heels, whether you have alcohol, whether you're fatigued, all that kind of stuff.
Whatever it is.
Anyway, yeah.
Well, and the heels only seem to be getting higher these days.
They do.
So you brought here a diagram of a foot, and you can kind of show us exactly what it does whenever you put these puppies on. Right.
If you actually just look at this model, and we start from the toes and move up to the heels, you'll see it sets you up for a problem. So first of all, the slant of this heel.
Because this is the bone that should be upright.
Right. So this is your ankle bone, and this is your foot, and your toes are down here.
Okay.
So the studies have showed that anywhere over 2 inches, 3 inches increases the pressure on the toes by 76%.
Okay.
So as the foot goes into this position, all of the pressure gets put on the ball of the foot. Now the toes also have to go up to hit the ground.
Right.
So that crunches the toes, it pushes the fat or the cushioning on the bottom of the foot forward. So you're putting all that pressure on the ball of the foot. So that can cause stress fractures. It could cause and calluses as the toes are getting scrunched together.
Yeah, which I'm sure you see a lot of.
A lot of hammer toes, a lot of bunions, a lot of corns. Especially as the shoe gets higher. Something as low as 2 inches increases it by 57 or 60%. So
does it help? I mean, a lot of the shoes these days have this hidden platform inside.
Yeah.
So does that help at all?
It does. I think if you can distribute the weight among all the toes, it's better. However, this shoe has this narrow top that squeezes the toes together, so that causes problems as well.
So I put my big girl shoes on for you today.
They're very cute.
I have a saying: the higher the heel, the closer to God. So for folks like me, for women who feel like they just can't give up their high heels, what can we do to try and minimize the risk?
Okay. Well, here's some recommendations. First of all, anything lower than 2 inches is probably safer.
Oh,
I know.
What? Might as well be in a flip-flop.
I would also limit the amount of high heel time you're going to be on your feet. So, you know, a few hours, you're going out for a cute date, or, you know, you have a party or someone to go to, you wear the heels. But, you know, as you drive back and forth to the date, or as you drive back and forth to your meeting, you should wear flats.
Okay.
You know, the other problem is if you're in your heel like this for a long time, your Achilles tendon, your calf muscle gets very tight. So that's why when you want to wear flip-flops, and you try to get your foot flat on the ground, it really hurts, and it can cause a lot of strain in your muscles. So I would say stretch your muscles every day if you're going to wear heels. Before the shoes, after the shoes, stretch that calf muscle.
And take some breaks.
And take some breaks. Wear a platform so you have more stability so you don't twist your ankle.
Okay.
Protect
Good
yourself.
advice. All right, Dr. Stephen Neufeld, thank you so much. Appreciate the advice, and I'm very happy to know that I can still wear my heels, just in moderation.
In moderation.
All right, thank you.
You're welcome.